Today we are here to show some exercises that we use in our office to build stronger, faster, and less injury-prone runners. There's lots of exercises that you can use just to build a stronger muscle, but the key is to focus in on exercises that develop the foundation of what makes for a good runner. And that is good hip stability, good knee stability, good ankle stability, and good balance. So today we're going to show you a few different exercises that help to achieve those goals. So our first exercise here is called the step down. And we can do this in three different positions: the lateral, the posterior, and the anterior step down. The easiest to start with is probably a posterior step down. So we're going to stand on one leg. You're going to reach back behind you and just lightly tap the floor and then return back up. In this case, you can lean forward just a little bit at the hip. And you'll feel this typically in the posterior part of the glute, a little bit in the quad, and even a little bit in the hamstring. With any of these step downs, again, the idea is to tap the floor like you're stepping onto an egg, not like you're actually stepping onto the floor. Likewise, as we do a lateral step down, we're just going to reach out to the side and touch and come back up. With all of these, we're going to try to keep the posture very tall. You're going to try to keep it in one line. We don't want the knee to crash inward. We don't want the hip to go outward. Just nice, slow, balanced step and back up. The last one is an anterior step down, and for this it's a little bit more knee shear, a little bit more stress to the anterior part of the knee. But if you don't have a severe knee issue, it's actually very helpful because it builds some strength in the quad. So with this, we're just going to reach out in front of us and lightly touch the floor and come right back up. Again, keeping that knee very much in line with the rest of the body. Don't want it to be crashing inward. Trying to keep it very controlled. For these next three exercises, we're going to use the quadruped position. The quadruped position is a great exercise for runners that are coming back, particularly from a hip injury, because we can isolate the hip and use it with proper motion and retrain the brain to use the hip in the way that it should be. So for this, we're going to use a resistance band, something like a TheraBand here that's been just tied into a loop. We're going to simply just slip it over the leg up to the thigh. And for this, we'd like to have a TheraBand that has a fair bit of resistance. From here, we're going to just assume the quadruped position. So hands and knees right underneath the hips, hands right underneath the shoulders. And we're just going to simply do three different movements. The first one is hip extension, just sliding the leg straight out and right back. We want the motion to only come from the hip. We don't want a lot of rotation to get it there. We don't want a lot of hyperextension to the lumbar spine. We want just simple movement right at the hip joint. The next one's a donkey kick, and we're just going to do a lot higher elevated, just try taking the foot right to the ceiling. Again, using that resistance band to really target the glutes and the hamstrings. And the last one is a fire hydrant. So from the same quadruped position, we're going into a lateral abduction. Really working the G medius muscle. Now, these exercises work best when they're done all three back to back to back, and particularly a way that helps to build hip endurance, something that runners need as they go longer and longer into the races. If the hips start to fatigue, running form breaks down, and injury will ensue. So these three exercises can help to really build that hip endurance very efficiently. For our next exercise, we're going to show a wall lean, and this is an isometric exercise meant to target the G medius muscle. This muscle is used to stabilize the hip. It's kind of the rotator cuff of the hip joint. And so for this exercise, you're going to bring your knee into the wall. You're going to stand, in this case on my left side, and I'm going to use my foot and hip muscles to push my body into the wall. And by doing that, you'll feel that activation of your glute medius muscle, and try to hold that for about 30 seconds. Now, to advance that, stand a little bit wider, put your knee back into the wall, and go again. So an advancement of the wall lean is to use a Swiss ball or even a small soccer ball that works really well sometimes. And so in this case, you're going to simply put the ball on the wall. You're going to take that knee, and instead of using the wall, you're going to use the ball to push your weight into it. So again, still using the stance leg like we did in the wall lean, activating that G medius muscle. And then from here, we're going to kind of activate that leg as if we're running. It kind of mimics that running motion that we like. again, kind of making this a little more functional exercise. Try that one, it works really well. So for this exercise, we're going to show the one leg deadlift. A good kettlebell is helpful for this exercise. We're going to place it across midline. So in this example, I'm going to stand on my right foot and I'm going to reach across and grab the kettlebell with my left hand. A couple things to watch out on this, of course, is we want to make sure we keep good balance throughout the exercise. We don't want a lot of over rotation through the trunk. We don't want to be bending and flexing through the trunk. We want that motion to be coming from the hip. And this helps to train eccentric contraction of the hamstring and glute, which is really helpful, particularly for downhill running. It's very helpful for keeping control of the hip. It's a good way to build some endurance and again some strength there. And particularly good for those who have a little bit of anterior knee pain, as this is the activity where often they fail and they'll start overloading the quad, which in turn creates the patellar tendonitis or the runner's knee, as often it's known as. So again, here's the exercise. We're going to stand on one foot. You're going to bend and move at the hip, reach down, grab the kettlebell, and stand back up. And then we'll return it back to the floor and back upright. And we keep another repetitions through that exercise there. That's the one leg deadlift.